YouTube! Thank you for tuning in to my acne series vlog episode number 2. This is start of month 2. I just got done with month 1 on isotretinoin, and I have to say that I'm very pleased so far with what's going on with my skin. So let me show you. So as you can see, I really only have one right here, and then everything else is just very flat. There's not any raised bumps along my chin. These are just scars, so that's manageable, but there's not anything crazy going on. And then let's look at my forehead. So that's also really flat. There are some scars going on, but all that's manageable. So in other words, I have to say that I'm happy so far. I will say that I'm nervous still about possible side effects, but so far so good. I don't have very many. The specific brand of the isotretinoin that I'm on is Clarivis, which looks like this. So the Clarivis comes in a blister pack, and it has 10 pills in each pack. I am prescribed to take 20 milligrams twice a day. For the first month, I was only on 20 milligrams once a day. He has now doubled my dose, so I take 20 milligrams twice a day. And he explained to me that for my particular size, my body weight, I need to be on a total of 40 milligrams a day, which is 20 milligrams twice a day. So he said once I'm on that dose, I will be on this dose for 6 months minimum. Hopefully just 6 months, because I think so far my skin is just really responding. So as long as this stays that way and I still have positive results, I should be able to get off the medication after 6 months and then be smooth sailing from there. So this is what the package looks like. You'll see that there's all these crazy warnings all over, like so. And then there's actually this right here, there's a booklet that opens up really big. And I read the whole thing on a different package, but I wanted to show you guys the nice one. So, anyways, it goes over all the possible side effects that could happen that are considered serious side effects. The number one being don't get pregnant whatsoever on this medication, because your children will have birth defects. So, don't get pregnant. Every month, if you're a female that can reproduce, then you're required to go to your doctor and get a pregnancy test. And you're required to prove to your doctor that you're not pregnant. And then you have to go and, once they get the results back, and answer your I Pledge questions. And you have to enter your 2 forms of birth control. Your doctor does the same thing. And then the pharmacy will confirm all of this before they are allowed to give you your prescription. So it's kind of a journey. And it was actually a pain to get this filled, because I had to look all over a bunch of different pharmacies. My normal pharmacy didn't carry this one, so that was fun. But I got it finally, literally the day before. If you miss the cutoff date, they make you do the whole testing cycle again, and then you have to miss some days, and it's kind of like, well, that sucks. So I would recommend, like, as soon as you get your prescription, go try to fill it, because they might have to order it. My pharmacy didn't carry this. They had to order it. Luckily, thank you, rush ordering it, they got it in. That was kind of stressful. Anyways, so let me talk about the side effects that I am experiencing and what I think about them. So number one thing that I've noticed is that my lips are dry. I will say that I haven't had any cracking or bleeding lips or anything crazy like that, but with that being said, I have been a freak about applying Aquaphor all the time. Like, seriously, this is the Aquaphor I use, and I carry this baby with me everywhere. I have one in my purse, I have one by my bed, I have one in my gym bag, I have one in my car, I keep one at my boyfriend's. I literally have Aquaphor everywhere. Aquaphor is literally the bee's knees. I don't think I would use anything else for the isotretinoin experience, because honestly, my lips actually feel moisturized. They're dry if I don't put the Aquaphor on. Like, there's been a couple occasions where, like, I'll fall asleep and I'll forget to put the Aquaphor on, and then that's when I wake up and my lips are super dry. So I know they are dry, but I will say that as long as this is coated on my lips, super thick, almost like it looks like I have lip gloss on at all times, then my lips are hydrated and I don't have any issues. So I just make sure to really get it in the corners of my lips and all around, and then we're all good. The second thing is that I'm actually like not upset about this one. My hair is really dry. So I just washed it, but like I went 4 days without washing my hair, and I work out all the time. So I did cardio, I did a leg workout, like I did a bunch of workouts and my normal routine, but my hair looked like I went to the salon. I was like, okay, well, yeah, my hair's dry, but I guess I don't mind. So that is something that I know is very common, is to get dry hair, but I think we can all agree that it's actually really awesome that I don't have to wash my hair every single day. I used to have to wash my hair daily, and I could sometimes get away with it if I would, like, on the second day put my hair up, but it would always be a little greasy, and I just didn't like that look. So I'd always end up washing it regardless. So I'm really thoroughly enjoying the whole dry hair thing. But I will say that I am putting plenty of oils in my hair. I use Oi conditioner by Davines. I put that in my hair, let it sit for as long as I could tolerate it, usually about 5 to 10 minutes. And with that, like, my hair isn't super crazy dry yet. Obviously, I'm on just starting month 2, so we'll see what happens with the dryness as far as the hair goes. My skin isn't too dry. I've been really on top of moisturizing and putting on tons of sunscreen. I haven't turned red yet. I know some people get this like pink color sometimes. I don't have that, luckily, so far so good as well with that. The only really like uncomfortable thing I'm experiencing is that my eyes are super dry. I wear contacts and I'm pretty blind, so I have to have something on. Lately I've been wearing my glasses a lot, just because it's so drying that like after a while my contacts are just like extra dry, and I put drops, artificial tears in my eyes all the time, but honestly, like, I would say that it's more comfortable for me to wear my glasses right now. I know that could be a common side effect as well, to have dry eyes. I've heard that from many other people, so I'm not super concerned about that one. It's just kind of annoying that I can only wear my contacts basically during the day, and then there comes a certain time at night where my eyes are just like way too dry and I have to take my contacts out and put my glasses on. So even then, I have eye drops with me at all times. I use these Replenish eye drops. Look like this. I don't know if that's focusing. There we go. So these actually have castor oil and glycerin in them. Yeah, glycerin. So glycerin is what my dermatologist said will really hydrate my eyes. So I've been using this like crazy. So far this actually helps a lot. So those are the things that I'm experiencing. I don't have any mood changes. I actually feel so much happier now that my skin is clear, and I feel much more confident. And like, I was really scared about having to deal with maybe if I got depressed or something, but so far, like, I actually feel happier. And I think that it's mostly due to the fact that I'm starting to get my confidence back. Because before, I would never be caught dead going in public without makeup on, and now I actually feel okay. I've kind of learned to embrace a little bit of my scarring. I will put like a tinted moisturizer on sometimes, but I don't necessarily feel like I have to cake on the makeup like I was before. Before, I would not even take my dog out if I didn't have makeup caked on my face or a hat or something, because I was just like, oh my gosh, on my face. If you've ever had crazy acne, you know what I'm talking about when you feel like when you have these active breakouts on your face that people are just staring at you. Like, someone might just be looking at me, but like in my head, I'm thinking that person is looking at my big zit on my face, which is, it's just embarrassing. I never had acne when I was younger, but I started getting it when I was an adult. So I never had to adapt to that. I always had really clear skin when I was younger. So now that I have been through this experience of having horrible skin, it's just like, okay, I don't want to go outside. And that's hard to deal with. But thank God this medication is working very, very rapidly on me, because I feel so much better. So I would say that my mood changes are actually positive mood changes, and I think that that has a lot to do also with my mindset. I'm kind of a happy person anyways. I do say in the past that didn't make sense. In the past, I had experienced issues with depression, but that was more situational when I was dealing with a pain disorder, and I was on tons of crazy medications for a whole other issue I had while I was younger. So I kind of associate the depression with that. I don't think that I myself am a depressed person. I think that I can get depressed in certain scenarios. But in general, I'm a pretty happy person. I'm always kind of positive and just trying to be super smiley and goofy, because that's how my personality is. So I don't have any issues with that yet either. So hopefully that stays the same. And other than that, I'm actually really satisfied with my experience so far. And I will be posting updates. I'm also going to do a video on my skincare routine, because I think that the products that I'm using are remarkable, and they have definitely helped with the whole process. He also has me on a retinoid cream and a glycolic acid peel. So that is helping with the scarring. My scarring is actually reduced already, which is also really great, because I don't want to have all these red spots all over my face forever. So I'm already doing stuff to help that process along. And then once I'm off the isotretinoin, he said we can look into things like microneedling and possibly lasers. I'm not 100% sure what route he's going to take with my scars, but I will keep you guys updated and share my entire experience as well. I'm going to be completely honest with you about everything I'm dealing with. If I don't like something along the way, I will tell you, just because I feel like it's important to share the true experience and not this, oh, this is how it's going to be experience. No, this is truly how I'm feeling, and I really am happy so far. So thank you guys for listening, and I will see you guys again with my next acne update. Bye!